From Kalamazoo, direct to you, it's a WKZO.com quickcast.
President Obama, in one of his speeches, talked about the unnecessary testing that's done by doctors, and apparently somewhere in this plan there's an idea to do something about this. I think that the unnecessary testing is maybe unnecessary for the patients, but it's necessary for the doctors to protect themselves from malpractice. I think I've heard different numbers, 15% of our health bill goes to protect themselves, the doctors, to protect themselves against malpractice. So one thing that I would like to see in any kind of initiative would be malpractice reform or tort reform, whatever you want to call it. And that's not in this bill. It's, I don't know how many pages, 1,400 pages long. There's nothing about tort reform in that bill. The other thing is that portability would save money. Just like we have with automobile insurance, you can shop around and you can get a plan that has catastrophic prevention, or you can, if you want something that's got psychiatric or Botox or whatever. But there's mandates in the state plans. Maryland has 66 mandates in their state plan, and so if you live in Maryland, you have to get your insurance from the Maryland provider, and it includes a lot of things that a lot of people don't want. So another thing that I think should be in any kind of healthcare reform would be portability and no mandates, so that we could shop for just a catastrophic policy, or we could shop for the Cadillac, or we could do whatever we want. So those are two things, neither one of which I think are in the current legislation. Another thing, I guess I got 4 minutes, man. I could talk for a long time. Another thing is, somewhere on page 800 or whatever, there's a section about this end-of-life counseling, which is mandated. Now, this is what I've understand to be. I'll just tell you what I've heard it is. Maybe it's not it, but end-of-life after you're 65 or older, mandated every 5 years. Call it end-of-life, call it whatever you want. But there's a mandated counseling function that, to me, is redundant, because if you're a responsible adult, you've got a living will, you've told people what you want to do with your end of life. This sounds to me like something that would just make a bunch of jobs for bureaucrats and really wouldn't. But if you're going to save $500 billion by reducing Medicare costs, the way to do it is by limiting end-of-life coverage, and that would be I would be against that. And the final thing is, if it's too big to read, it's too big to work.